Hello viewers, my name is Bernajis. You can also call me Bernajis. I am the founder and the director of the health organization Bernajis Preventive Health Education. I'm also the author of the public-friendly medical book titled The Role of Public Medical Knowledge in Disease Prevention and Treatment. Well, I am a senior nurse clinician and I work in one of the teaching hospitals in Ghana. I am a passionate advocate for primary or preventive health care because I believe it is the best and the cheapest form of health care anywhere in the world. We have been learning about disease topics for some time now. I have presented on a number of disease conditions like diabetes, hypertension, sickle cell disease, kidney disease or kidney failure, hernia, among others. The video presentations on these disease topics are on my Facebook page at Bernajis Primary Healthcare Media. Please go to the page and watch the video presentations on those disease topics. And if you like my content, share it and invite others to join us, learn together how we can all maintain excellent health. You can also visit my YouTube channel, also at Bernajis Primary Healthcare Media, and watch the video presentations there. If you have not yet subscribed to my YouTube channel, I am encouraging you to just support my effort by clicking on the subscription button. It is my pleasure to start presentation on another disease topic, and that is uterine fibroid or simply fibroid. Uterine refers to the uterus or the womb. Fibroid or uterine fibroid is a health problem in females only. Men have nothing to do with this health problem, fibroid or uterine fibroid, because fibroid is strictly associated with the organ uterus, and we all know men do not have uterus. Men do not have the organ uterus or womb. It is women. So it is a health problem in only females. We all know men and women do not always have the same biological features, and this can bring about certain specific diseases or health problems occurring in only females, and then one also occurring in only men. The direct question is, what is uterine fibroid or fibroid? Well, fibroid is a section of the uterus or sections of the uterus growing into hard mass which is round and appears almost white in color. I will take it again. Fibroid is a section of the uterus or sections of the uterus growing into hard mass which is round and appears almost white or has silvery appearance. I hope you'll be able to understand this definition or explanation going forward. The next question is why and how the growth of fibroid or this hard mass or tumor associated with the womb. Nobody knows as at now the exact cause or reason for the growth of fibroid. Yes, scientists are not able to tell the exact cause or reason for the growth of the fibroid, but this is the fact. Fibroid can occur in a female once she starts menstruating. Fibroid can occur in a female once she starts menstruating. I'm using the word female here because a teenager of 13 or 14 years who menstruates can develop fibroid. So fibroid is, or the development of fibroid is directly linked to the activities of hormones that control menstrual cycle. For example, estrogen. I will take it again. Nobody knows the exact cause or reason for the growth of fibroid, but fibroid can occur in a female once she starts menstruating. So any female who menstruates is at risk of developing fibroid or can develop fibroid. And I said the development of the fibroid, the growth of the mass or tumor, is directly linked. It doesn't mean that it causes exactly, it's the exact cause or it causes it directly, but it is linked. It is found to be linked to the activities of hormones that control menstrual cycle. For example, estrogen. I have seen young ladies in their early 20s in theater for fibroid surgery. Fibroid is not a health problem in only older women. Fibroid can occur in young ladies or younger women. So with this explanation, please don't even be alarmed if a teenager develops fibroid. It can happen. Please note this. Fibroid is not cancer, or fibroid is not cancerous. Fibroid is not a sign that a person will later develop cancer. Please take note of this point. Generally, fibroid is not harmful. Many women in lifetime have developed fibroid without even realizing it, because fibroid is not harmful generally. However, some women develop health problems based on certain factors associated with fibroid. These are the factors: the location of the fibroid, the size of the fibroid, and the number of fibroid or tumor. I will take it again. Fibroid generally is not harmful. Many women have developed fibroid without even realizing it because it wasn't giving them any health issues. But some women develop some form of health problem based on certain factors. And these are the factors: the size of the fibroid or tumor, the location of the fibroid or tumor, and the number of fibroid. Let me say something briefly on each of the factors. The location of the fibroid tumor. We have types of fibroid based on the location of the tumor on the uterus. So these are some of the types of fibroid we have. We have what we call intramural fibroid, submucosal fibroid, and subserosal fibroid. What is intramural fibroid? This is the type where the tumor, the fibroid tumor, occurs within the muscles of the uterine wall. With this type, the fibroid or the tumor develops within the muscles of the walls of the uterus. With this, if the tumor is large enough, it can stretch the uterus where it will show outwardly as the woman or the lady is 9 months pregnant. Obviously, something like this will give some form of health problem to the individual. The next one, submucosal fibroid. This is the type where the tumor occurs just under the lining of the uterine cavity. With this one too, if the tumor is large, it can block the fallopian tube. This will also definitely implicate fertility. The last one, subserosal fibroid. With this type, the tumor occurs on the outer wall of the uterus. It can develop on what we call stalk. The next factor that can determine if fibroid will give some form of health problem in a woman or a lady, the size of the fibroid. Fibroid tumor can be small in size or large in size. Clearly, if the tumor is large, it can give some form of health problem in a woman or the lady. The next factor that determines if fibroid will give some form of health problem to a lady or a woman is the number of fibroid tumor. Fibroid tumor can occur in multiples in one person. I had been involved in surgical procedures to remove fibroid tumor in a patient. In some instances, the surgeon took out multiples of fibroid tumor. Some 2, 3 tumors were removed from the uterus. Others to just one, which was able to give problem in the woman or the lady. In other surgical interventions too, I saw the surgeon removing about 5, 6, 7 pellets of the fibroid tumor from the uterus. So fibroid can occur in multiples in the womb, and this definitely can give some kind of health problem in the lady or the woman. Now let's take a look at certain signs and symptoms associated with problematic fibroid. There are signs and symptoms related to fibroid that give problem in a woman or a lady. These are some of the signs and symptoms. We have unusual heavy menstrual bleeding. So fibroid can cause a lady to bleed heavily during menstrual period. Another one is pelvic pain. That is pain around the lower abdomen. The next sign or symptom is excessive passing of urine or difficulty in passing urine. And this is due to the pressure the tumor exerts on the bladder. Another sign and symptom of a problematic fibroid is issues with fertility. A problematic fibroid can cause ectopic pregnancy in a lady. Or fibroid, based on the factors that we have looked at already, can cause complete infertility in a woman or a lady. Another sign or symptom associated with problematic fibroid is bleeding in between period. That is, she is not in her menses and yet she is having some form of bleeding. Fibroid can cause that. Well, these are some of the problems associated with fibroid. These signs and symptoms that I have just mentioned can be caused by other disease conditions. But in case you are beginning to experience any of these signs and symptoms or health problems, kindly go to the hospital to be properly examined. It could be fibroid or some other serious health problem. Now let's look at treatment of fibroid. One could only think of treating fibroid if it is giving some form of health problem. Otherwise, there is no need to treat the fibroid or to remove the fibroid tumor because they are generally not harmful. But based on all that we have discussed earlier on, based on certain factors that we have already talked about, fibroid tumor can cause serious health problem in a lady and it has to be treated or removed. Generally, we have different treatment options for fibroid. We have different ways of treating fibroid, but all the treatment options involve some form of surgical intervention or procedure. I will take it again. We have many different treatment options for fibroid, but all the treatment options involve some kind of surgical procedure or intervention. I'm stressing on this point because scientifically, medically, there is no drug that one can take to remove fibroid tumor or to treat fibroid completely. We don't have drugs that one can take to treat fibroid completely. Even if we have drugs for treating fibroid, the drugs are meant to treat certain signs and symptoms associated with the condition, but not to take out the fibroid tumor. I do hear a lot of people advertise drugs. Again, our herbalists, they advertise drugs to people that the drugs can treat fibroid or to melt fibroid. But there is no scientific evidence that one can take drug or drugs can be used to remove fibroid. So those of you who listen to these people, please reconsider. Don't go in for any herbal preparations or drugs to treat fibroid. You cannot remove fibroid with drug except through some form of surgical procedures. When you go in for these drugs, you are not helping yourself in any way. You are only putting pressure on other vital organs. For example, the kidney, which in later life can give you serious health problem. So go to the hospital, let the medical professionals examine you and give you the best treatment option available for treating fibroid, and not to resort to taking herbal preparations or medicine with the hope of melting fibroid. We do not melt fibroid or take out fibroid with drugs except through some form of surgical procedure. Just like I said earlier, we have many treatment options for fibroid, but I will talk about just two of them. These two are traditional methods. They are the commonest treatment options for fibroid, and they are myoectomy or abdominal myoectomy and hysterectomy. What is abdominal myoectomy? Abdominal myoectomy is the opening of the abdomen, the surgeon getting access to the uterus, search around it and within it, and then remove the fibroid tumor. That is about abdominal myoectomy. The surgeon opens the abdomen, cuts through the abdomen, get access to the uterus, search within it and around it, and then remove the fibroid tumor and then put it back in shape. Hysterectomy is the complete evacuation or removal of the womb itself. I will take it again. Abdominal myoectomy involves opening of the abdomen, getting access to the uterus, searching around the surgeon, searching around it and then within it to remove the fibroid tumor and then get the uterus back in shape. While hysterectomy is the complete removal of the uterus itself. Yes. Let me say something briefly about the hysterectomy. Among all the treatment options, the only effective means of treating fibroid completely is the hysterectomy. The only treatment options which avoid any risk of regeneration of the fibroid tumor is the hysterectomy, that is complete removal of the uterus. I said earlier the fibroid is strictly associated with the uterus. So if the uterus is taken out, there is no risk of it developing again. That is, the risk of developing fibroid is completely taken out. So the woman is free from this fibroid disease again. This means that the lady or the woman will be without a womb. Yes, I said earlier I work in theater, and I have seen a number of women who came for this treatment option, hysterectomy, complete removal of the womb, so that they no longer possess womb and they are no more at risk of developing fibroid. And this treatment option is best for ladies who have no plan of conceiving again. So a woman who has already had a number of kids and doesn't want to give birth again can definitely go for this treatment option. But it is a challenge for ladies who want to conceive or give birth. With hysterectomy, the surgeon can remove just parts of the uterus, making it partial hysterectomy. Or he or she can remove the entire uterus, like I said earlier, making it total hysterectomy. Any one of these options depends on the severity of the fibroid problem in the woman or the patient. Apart from hysterectomy method of treating fibroid, there is a risk of regrowth of the fibroid tumor in all the other treatment options. Yes, hysterectomy method, like I said, is the only treatment options where there is no risk of regrowth of the fibroid tumor. The other options, there is risk of the fibroid coming back. So I have seen ladies come to theater on 2, 3, 4 occasions to treat fibroid. This is the reason why when a young lady is having these problems, having problem with fibroid, where it interferes with pregnancy, she is advised to give birth early so that the fibroid will not grow back to hamper the process of pregnancy. This is the reason, for instance, the myomectomy, which involves cutting open the abdomen, getting access to the uterus, the surgeon observing, checking around or within the uterus just to remove the fibroid tumor. Maybe at the time of the surgery, the surgeon could not see smaller fibroid under development, fibroid tumor under development. The surgeon only removed the fibroid tumor that he or she can see. He is able to remove those that he or she can see. How about those that are small, tiny, and he or she is not able to see to remove them? This means that once the surgeon is done, close the womb, close the abdomen. In the next 1 year or 2 years, the smaller tumors which were under development can now grow bigger to cause the same health problem that the lady was facing. Yes, so this is why ladies, young ladies who plan to give birth and then the fibroid tumor is interfering with their pregnancy, they are advised to conceive early in order to prevent the fibroid from interfering with their pregnancy. Let's get to another area of the topic, prevention of uterine fibroid. Can one completely prevent the occurrence of the fibroid or uterine fibroid in the womb? Well, we have learned that we do not have direct causative factor of uterine fibroid. You can't pinpoint one particular thing as the cause of the fibroid in the womb. The condition is only linked to hormonal activities that control menstrual cycle, which is estrogen. So a lady can only be off the risk of developing fibroid if she does not menstruate at all. Yes, a woman or a lady can only be off the risk of developing uterine fibroid if she does not menstruate at all, which means that the hormone estrogen is not there, it is not active. Hence, the risk of developing fibroid is no longer there, or it is lowest. Based on this, one does not really have much to do directly to prevent the occurrence of this uterine fibroid. Yes, it means that any lady at all is at risk, and there is nothing directly one can do to prevent the occurrence of uterine fibroid. Uterine fibroid and its problem is not that widely common. It is not that widely common, just that some women or ladies are unfortunate and then it gives them problem. This brings me to another important point. The risk of developing uterine fibroid is lowest in older women in whom menstrual cycle is ceased due to menopause. Yes, the risk of developing uterine fibroid is lowest in older women in their menopausal state. And based on all that we have learned, the reason should be clear to you that the hormonal activity that control the menstrual cycle is no more there. Estrogen is no more there. The activity of the hormone estrogen is no more there. Hence, the risk of the tumor happening in older women in their menopausal state is lowest. In fact, it has been observed that fibroid tumor in women in their menopausal state actually shrink. Yes, fibroid tumor in women who are at their menopause state shrink, and this is due to the fact that the fueling factor that helps the growth of the tumor is no more there, which is the activity of the hormone that control menstrual cycle, estrogen. This is the last area of the topic, but before I end it all, I would like to reiterate the point I made earlier on, that we do not have drugs that remove fibroid tumor. We do not have drugs that melt fibroid tumor as many believe. There is no drug treatment of uterine fibroid medically. So please do not go out there looking for drugs that you can use to treat your uterine fibroid. Go to the hospital, let the medical professionals examine you and give you the best treatment option available. I believe this treatment option of using drug to take out fibroid tumor is sought by people who fear surgical procedure. Yes, there are a lot of people who do not want to undergo surgery, so they look for alternate treatment to avoid surgical procedure. But that should not be the case for uterine fibroid. I had worked in theater before. One of the safest treatment option is surgery or surgical procedure. Death through surgery is rare in theater. So don't be afraid to undergo any form of surgery and then go out there using treatment options that in later life will harm you or will not even benefit you at all. Treatment through surgery is harmless, it is not dangerous as many make it to look. Yes, so go to the hospital. If you have uterine fibroid, let the medical professionals examine you and give you the best treatment option. Well, this is the end of my presentation on this health problem, uterine fibroid. I hope you have learned something. Continue to visit my page and watch my video presentations on disease topics there at Bernajis Primary Healthcare Media. For more information on this particular topic, uterine fibroid, kindly speak to your healthcare provider. Until then, I encourage you to continue being health conscious. I encourage you to do things that will improve your health. Always remember, your health is one of your greatest assets. Look out for the next presentation on another disease topic. Thank you very much for your attention.